So today we will be going through FMGE Recall, what were the subjects from which the maximum questions were asked, how the students fared, and what would be the likely suggestion for the new FMGE batch. So as far as the subject-wise weightage of the this year FMG 2025 was concerned, so we have got the recall, which we will be going through in a very detailed manner so that the most of the students they benefit from this recall. So your aim is to just have a good internship, have a good house job, and after that you have to go for the FMG examinations and further for the NEET PG examinations for getting the branch of your choice. So that's the objective. So as far as the subject-wise analysis of the current FMG examination was concerned, herein I have just highlighted some important things. So you see anatomy, you see biochemistry, you see PSM, you see medicine and medical specialties, subspecialties, you see surgery, you see ops and gynae. So the relative percentage of the questions which were there from these subjects, I mean to say that anatomy, especially PSM and medicine. So over here we have got these two subjects, and in addition to that we have got the subjects like surgery in here, the ops gynae in here. So these are the subjects which majorly are asked and from which you expect quite a good percentage of questions. So overall, we can see that we had 12 to 16 questions from anatomy, in anatomy and surgery, ENT, or obstetrics included, because you get overlap of the questions in these subjects. In the PSM and social and preventive medicine and medicine, you see that we have got a good chunk of questions. So these cannot be ignored at any point of time. FMG student cannot ignore these subjects. Surgery and obstetrics gynae, almost 15 to 18% of the questions from surgery, and obstetrics gynecology, 15 to 20% of the questions, because of overlap of some of the questions. Now that means we are left with the conclusion that you mean time. What is the FMG student wherein he has to spend a lot of time? I mean to say that if he has got 1 year to prepare, I guess 8 to 9 months he should be very much overwhelmed and busy with these subjects, like which we are called as major subjects. So main time by FMG student is on subjects like sorry, anatomy, biochemistry, pathology, pharmacology, microbiology, PSM, medicine, surgery, obs gynae. So I mean to say that this table happens to be very, very important. And why important? Because many at times we find that students, they have got their own choice of subjects, and what happens, they just go, say for example, a subject like dermatology. Some student might be having a liking for dermatology, but he will study dermatology for 4 months. So what that does, he or she just makes herself to suffer in as far as the number of questions asked from other subjects are concerned. So that way a student is not doing justice with the whole FMG. Maybe an inclination for certain subject can drive a student towards more consumption of time in that subject. But here a student has to be really well planned, giving time to the appropriate subjects, giving proper time to the proper subjects. One cannot be obsessed with one subject. And what that does, we see many a times a trap. A student just does not finish the major subjects within 9 months, and at the end he just is very much confused in the state of he does not enter the examination hall with confidence. So that is very, very important. So that does not mean that we have to neglect these minor subjects. We cannot. That's a very important bottom line I'm drawing over here. We cannot neglect minor subjects like physiology, forensic medicine, pediatrics, though pediatrics happens to be sometimes asked in a very, I mean, say, in a bigger manner. But last few years, the number of questions from pediatrics has not been as it should have been. But many a times the pediatric and the medicine concepts overlap, so there is not much of a difference. But you have to read medicine and pediatrics very strongly. Orthopedics, optho, ENT, radioderma, and anesthesiology, you get typically one-liner, image-based questions, and many a times many repeat questions. So what now the thing is that about the repeaters. So repeat questions. Some of the times we just take the books and we think that every time the questions will be repeated, 40-50% questions. No, 10 to 20% of the questions might be repeated, and that's also a good chunk. I would not underestimate that, but never focus your attention towards revising only the books with the previous year's questions, because trends are changing. You get good questions now, you get conceptual questions now, you get newer questions now, and that is why many of the students do not do well in the clinically oriented types of questions, because they are used to cramming up, memorizing these old questions, and that does not help them anyway. And this is a problem what many of the I mean to say educational companies giving education, they just focus on last year's question. They just have this knack of just giving the same repeated material to the students, running for decades together, and then that's why a student loses his objective. So that's very important. Now, as far as the difficulty level was concerned this year, FMGE questions were very simple. The paper was simple. It was not a complicated paper. You could just say that it was a moderately easy paper for good students who might have studied well. That is why many of our FMGE students from Bangladesh, from Philippines, from Malaysia, from Ukraine, from China, and from rest of the places who just appeared, they found that the paper was not that difficult. But unfortunately, as far as many students were concerned who just came, they had not read well, they had not put up that effort, and they had just gone through certain conventional things, and they did not do well. In fact, what's important is that you have, I again stress the need for a good strategy, a good timely strategy, a good knowledge about what to read, when to read, how to start, how much time to give. That's all well planned. So the difficulty level was there, just 25 to 35% questions were, what I can say, a bit difficult, not that difficult. To be very sincere, there were not very, very difficult questions. They were a bit difficult. And out of all these 25 to 35%, I think that if we go just have a good standard, I find that 10 to 15% of the questions just were of a level which we can call difficulty. Rest of the questions would fall in a moderate zone, and many questions were very easy, simple one-liners and memory based, and so overall, but but there was a difference from the previous, previous 3 years papers, because that's why I stress that those previous years papers will not help you much, because the strategy is changing and you have not to use the conventional methods now. So going about that, let me give you a brief gist of how the questions or what are the various types of questions which are asked. So you can see among the options, the biological value is maximum in. So this was a question in preventive and social medicine. So I don't think that it tests anything. There is no any concern. This is just a memory-based question, and you get questions typed like this. So this is just like a memory. You see these tables in any book, and your memory is a guide to answering such a question. That is one thing. Now, second question, which is, now see, a 2 centimeter tumor in a female shows no vascular invasion on histology. So, diagnosis is most likely. So, you have a tumor, no vascular invasion on histology, a thyroid tumor, and out of the, he has not mentioned thyroid tumor. He has mentioned follicular adenoma, follicular carcinoma, Hurley cell carcinoma. So, this is a follicular adenoma, follicular carcinoma, Hurley cell carcinoma, papillary carcinoma. So you can say that the question is not good. But the thing is that it is a female, no vascular invasion. That's important in case of follicular carcinoma, I have to remember. Diagnosis is most likely. Now, this most likely tends to be a very commonly used word. So what examiner is trying to get from you through an incomplete question, though, that this is a thyroid nodule, 2 centimeters in a female, most likely caused without capsular invasion. So it cannot be, I mean to say, most likely a carcinoma. And out of this, which is the most common condition, adenoma, follicular adenoma. This is an instance-based question. This is a question based on the frequency of the different conditions mentioned in the options, and based on one pathological feature, no vascular invasion. So out of these, you have to now, you could think a lot about this question, but coming to the basic answer and how to simplify your options is that the most likely, so you have to, the simple thing is that most likely is the follicular adenoma. That's important. A patient has an oncological condition, HTLV was implicated. HTLV is, now he has told you that patient has got a malignancy due to oncogenic potential of a virus, and HTLV is implicated. Now then he has given it HTLV1, so subtype. So then he's not asking you what is the disease is called, he's telling you about the microbiological characteristic of this virus. So single-stranded RNA retrovirus. So that means over here you have to go through the virology section very, I mean to say, with a lot of concentration. You have to know which are single-stranded viruses, which are double-stranded viruses, which are retroviruses, which are RNA viruses, which are DNA viruses. You have to have a good compact table of these things. So that is what I emphasize upon, that your concentration in reading and reading patterns should be such, and you should have such helpful material available with you, which just goes to the basic crux of the question and helps you in getting a good merit. Now, another question, type of question. Now, see over here, a 34-year-old female is diagnosed with pituitary tumor, and it is shown. This is an image-based question. Okay, so most likely visual loss would be. So herein, there's a pituitary tumor shown over here. Most likely pituitary microadenoma, or say a possibility of a pituitary macroadenoma, and it is pressing upon, there is something shown optic nerve, there's something shown optic tract, and there is something over here which is a point over here. This is the optic chiasma, and the tumor is pressing on the optic chiasma. That's very important. So what would be the vision loss? So I think that it is a simple question, but here this you have to correlate the things. This is an image IBQ, image based question, and you are to arrive at not the diagnosis, what would be the clinical effect of this thing. So bitemporal hemianopia, you know, a person would not be able to see the temporal or the lateral fields of the both eyes, very peculiar. So this can be, I have given it once I was discussing this thing, a person who has a friend, and the friend has got multiple scratches on his cars, right and left. So once you ask him, he says that, yeah, I'm having some problems in my driving, and that's why he has got a lot of scratches on the car on the lateral sides, on the right side, the left side. So these are observational things. So there can be something like a bitemporal hemianopia is having, and you can just ask him about the headaches and all those things, symptomatology, and then once you do a CT scan, maybe it might turn out to be a pituitary tumor. So these are the things which, as a medical student, you should know how to answer a question, and this cannot be done by cramming up these unnecessary long videos, and you have to go and have a good insight of what you read. The book should be like that. So that's important. And now, so the image-based questions were almost 15 to 20%, and that's a good chunk. I would just be very much happy about that, because these questions check your concept. Now, what would be my suggestions is that, again, I have been repeating it to the NEET PG students, the FMGE students, the concept remains the same. The concept of the examination, any examination, the concept is the same. That means that you have to have a brilliant concept about the basic things. You cannot afford to come and just, it is just not like T20 cricket that you come, you just hit for boundaries and out of boundary sixes. It's not like that. You come, you have to give time. It's just like a 5-day match. You have to give a lot of time. You have to settle in. You have to have a rest. You have to go through the things thoroughly. So what is the best thing? There is nothing, I tell you, as good as the standard textbooks. And what we mean by standard textbooks is Harrison, Robbins, Bailey, Park, Goodman Gilman, Cadson, Pharmacology. These are lovely books. I mean to say that you may by chance get, some people might be lucky enough to go through the exams with a bit of luck, but luck will not help each and everybody. So basically, I've seen the best students qualifying each and every examination on the surface of the planet with the help of standard text, whether be it USMLE, MRCP, MRCS, NEET, PG, FMGE, INIC, anything. A good student will qualify each and every examination, given the fact that he studies from the standard textbooks. So that's very important. Then best revision in QBank. I don't think there is any revision in QBank like Platinum QBank and NEET PGQR available. So that's it. No shortcuts. You cannot have shortcuts. I do not recommend shortcuts for success. No, there are so many people who are getting these video channels out. Every Tom, Dick, and Harry comes out with a video channel. Every Tom, Dick, and Harry comes with a, I mean to say, giving suggestions, giving advices, and I would highly, highly, highly not recommend going through this social media, Insta, YouTube, Twitter for unnecessary things, because I see a lot of students wasting a good amount of time on unnecessary long videos. The end yield and result is zero. People having false followers, people having, I mean to say, projected themselves as being pioneers of medical education, as being the best, and I find that their students do not do well. That's why you see the results of the FMG. You see the results of FMG not going above anywhere above 30% during the last 5-6 years. So they are in the range of 20s, below 20s. So it does not. It is your own effort. I would recommend you. It is your own effort, your hard work which puts in. And then other than that, there are these commercial entities who just boast much about themselves, but then every student would have qualified. No, it is not like that. So better is that you focus on your studies, work hard, and the standard textbooks and the best possible matter, which is and practice a lot of QBank. That's my advice to you. So I wish you best of luck. Thanks a lot.